Hello there everyone, this is Miriam from Pain Outside the Box, and today I'm going to share 2 tips, really simple tips that can drastically reduce the pain response if you actually follow them. So these are 2 things that I immediately did when I myself learned that my chronic symptoms were psychosomatic and due to TMS. So let me get to them right away. So number 1, do not talk to yourself and others at length about your chronic pain. So when we talk about our pain, we are making it the center of our attention, and we also are sending the signal to our brain that what we have is a huge problem. Because obviously when we talk about our pain, we usually talk about it in negative terms, right? How much it hurts, how awful it can be, and stuff like that. So when we are constantly discussing our symptoms, even if we're just describing them to other people so that they understand us, what we are actually saying on an unconscious level is, this is a huge problem. And this is the message that the brain keeps getting, that this is a problem. And since the pain response is fired when the brain perceives some kind of risk, then it's more likely to continue firing if you are describing your pain in terms of being a problem. And this can get even worse when you have caring people around you who actually constantly ask you about how you're feeling and about your pain. And you might feel that this is a nice thing, but actually, I'm here to tell you that it does nothing at all to help you recover. Because when we see other people looking concerned, okay, we see that look of concern on their faces regarding our own issues, our physical issues, the signal, again, that is being sent to our brain is that there is a serious issue. And in order to heal from chronic TMS pain, we actually need to teach the brain that this is not a big issue, that actually this sensation is safe, it's just an overreaction, it's just a habit that our brain and body have learned. And therefore, we have to learn to see it as less of a problem. And by talking less about it, this is actually the first step to do this. So that's number 1. Number 2, also very simple, though difficult for some people, is stop touching and fondling and caressing and, monitoring the pain area, okay? So I know it's difficult to stop thinking about pain, so I usually recommend to stop touching the area in the beginning, right? So, if you've had chronic pain, all those little massages, all those little things you've been doing to try and, guard the pain area aren't helping, right? Because you still have the pain. Cut those habits, because once again, those habits are sending the signal to your brain that this area needs protection, that it is vulnerable, that it is risky to be using it, okay? Especially if you're even moving while holding on to the pain area. For example, moving or bending down while holding on to your back. It's not helping. It's sending the message that that area is a problem area. And as I said before, when it came to not talking about your pain, we want to make ourselves, our brain, believe that this pain is less of a problem, okay? So as much as possible, cut out those habits. Just don't touch the area, okay? It's not about ignoring it. Sometimes you can't ignore the fact that you have pain, but at least don't baby it, is what I like to say. Okay, so try it out. Try out these 2 simple, harmless tips for the next week and see what happens, okay? Most people experience a shift already once they start incorporating these 2 tips. And also, finally, I'm here to announce that my pain reprocessing program is now out and available for purchase. And pain reprocessing is all about teaching the brain that the pain response is actually nothing serious, that pain is not always a structural problem. And as a result of various techniques and tools, the brain learns to interpret the pain differently. You decrease the fear and anxiety around the pain, and that's what leads to pain elimination in the long run. pain reprocessing is actually a science-backed technique today to actually reduce the pain response in the body and teach the brain that you are safe after all. Okay, so it's a 6-week program. It's totally online, totally DIY. So you have 6 videos by myself. I guide you through various techniques and insights, such as the ones that I've just shared. Okay, so what the 2 tips I've just shared are just the basics of pain reprocessing. And you also have access to downloadable meditations and other pain reprocessing exercises. Okay, and also some tasks to do week by week. So check that out. I'll put the link in the description, and make sure that you don't forget about my 2 tips for the next week at least. Okay, I'll see you another time. Bye-bye.